We're back and you're watching News Channel 3 live at 9. Depending on where you live, the pandemic and its subsequent stay-at-home mandates could be creating a boom of sorts. But experts say not every city or state in the U.S. will see a pandemic baby boom. This morning we are live with Dr. Aric Giddens, an OBGYN with Baptist Women's Hospital, to learn more about what the Mid-South is or could see coming up. Doctor, welcome to Live at 9. Good to see you this morning. How busy have you folks been?
Good morning. Well, we have been busy, and the last 2 weeks of December, we did see an increase in our deliveries. And going forward, we think that we're going to have a pretty good jump in January and roll over into February. Back in the summer, we noticed an increased number of what we call start prenatal care visits in our practice, and talked to other groups and relayed that information to the hospital, anticipating somewhat of a baby boom in Memphis.
So, Doctor, how prepared are many of our hospitals for something like this? I know you somewhat saw the warning signs coming, so to speak, but how ready? I mean, does this cause any issues from a good standpoint for capacity levels? Can most handle this?
Well, yes, the hospitals have worked very hard. We practice both at Baptist and at Methodist Germantown, and we've talked with the leadership for probably about 6 months anticipating this increase, and they have ramped up their staffing as best they can. Of course, with the pandemic, that's made things a little more complicated. They have people on furlough or on leave, and sometimes we do, but we're coping with it pretty well.
So good and bad. What about when it comes to potential hospital stays for these pregnant moms out there? Could they be potentially a little bit longer because of the pandemic? What are you anticipating there?
Well, no, I think they should have a pretty good experience at the hospital. The hospitals have done a great job at screening patients, and we do have to limit visitors, unfortunately, but we're taking good care of our patients, and I think the hospitals have done a very good job at protecting their staff, and I think we're ready.
I think you are too. For a typical year, and we know 2020 was anything but typical, what is this time of year normally like for many hospitals like yours?
Well, typically, December is pretty busy, and January is traditionally a busy delivery month for whatever reason. And we anticipate that we could see a bump of anywhere from 10 to 20% over our normal baseline for January. Our practice anticipates about a 20% increase in our deliveries for January over a typical year. That's a pretty big jump.
That is a pretty big jump indeed. To talk to us also from a family standpoint, for 2020 was a year where it was just so rough on so many folks. Can this also be kind of looked at, Doctor, as being somewhat of a silver lining for a lot of families, a lot of couples out there?
Well, hopefully it'll be seen that way. I think a lot of people were excited, and a lot of people took the opportunity. They were home and shut in for a long time and decided that it was a good time to either expand or start a family. So I think it's a joyous occasion. It's been tempered a little bit by external factors, but life goes on. Babies will be born. Life is celebrated.
And life is celebrated for sure. What about advice for those families out there, or those new families or expanded families? What do you tell them? How do you kind of prepare for this new family member?
Well, we certainly do talk to them in the context of the pandemic, specifically about the limitation of visitors and the precautions to take. That's the biggest difference we have versus a normal year.
Wow. Okay. But again, will there have to be any additional staff, anything like that brought on, you think? Do you anticipate that as well?
Yes, the hospitals have made accommodations to ramp up their staffing as best they can. You may be aware there's somewhat of a nursing shortage nationally and in the Memphis area with the pandemic going on, and there's just a greater need for healthcare workers. So we're experiencing that along with everyone else, but everyone's committed to pitching in, and we have to do our jobs.
And Doctor, you folks have done your job so well. What is 2020, even though I know we are finally into this brand new year, what has it meant to so many healthcare workers out there? You have seen not only yourself, but many of your colleagues having to juggle so much during this past year. What was that like for you?
Well, it was hard, but it was that's what we do, and I'm very proud of our colleagues, both at the hospital, my partners, my colleagues in the OBGYN community and medical colleagues. I think they've done a fantastic job in Memphis. I think the hospitals have responded very well to this crisis. And going forward now, they're starting the vaccination programs for the medical staff, and that's going well, and they're pressing on.
All right, 2021, a brand new year, Doctor. Dr. Giddens, thank you very much. Congratulations, and we appreciate everything that you continue to do for Memphis and the Mid-South. We do appreciate it.
Happy New Year.